The key achievements of Ayush in 100 days. Number one, donor agreement with the World Health Organization, that is WHO. A donor agreement was signed by the Minister of Ayush and WHO on July 31st, 2024 at the WHO headquarters, that is in Geneva. Number two, move with Vietnam on medicinal plants. India and Vietnam inked a memorandum of understanding, that is MOU, centered on cooperation in medicinal plants on August 1st, 2024. This agreement signed in the presence of our Honorable Prime Minister Sri Narendra Modi and his Vietnamese counterpart is a major step towards advancing traditional medicine practice in worldwide. Number three achievements of our Ministry of Ayush, that is landmark MOU with Malaysia and Ayurveda. India and Malaysia have taken a significant step in advancing traditional medicine by signing an agreement on Ayurveda. This partnership will promote research, knowledge exchange, and the certain of Ayurvedic treatment regimen. Number four achievement is promoting the One Herb, One Standards initiatives. On August 6, 2024, the Pharmacopoeia Commission for Indian Medicine and Homeopathy and the Indian Pharmacopoeia Commission signed a historic memorandum of understanding to carry out the One Herb, One Standard initiative with a large objective to improve quality of medicines in the sector. Number five achievement is special medical stores for Ayush medicine. To easily access the Ayush medicines and medications, Sri Pratap Rao Jadhav, Honorable Minister Ayush, announced on August 26, 2024, the government intended to open special medical stores at every tehsil level. Variety of herbal and traditional medicines will be made possible by these stores, improving public health care in both urban and rural areas. Number six achievement is NABH evaluation of 1489 Ayush Arogya Mandir completed. According to the report received from the National Accreditation Board of Hospitals and Healthcare Providers, the evaluation of 1489 Ayushman Arogya Mandir has been completed, and 1005 out of these have been certified for Ayush entry level certification. This initiative is an important step in ensuring quality healthcare services under the National Ayush Mission, that's NAM. Now the major campaigns and initiatives. Number seven, Har Ghar Ayush Yoga campaign for all healthier India. The Har Ghar Ayush Yoga initiative was started by the Ministry with the goal of increasing the uptake of Ayurveda and Yoga in communities, including yoga in the Fit Indian School certification is one of the highlights. And another important thing is Bharat Ka Prakriti Pariksha Abhijan to be at the core of the initiative, and the broad roadmap to involve stakeholders across the country has been prepared. Number eight, Ayush camps for geriatric population. It is very important. Minister of Ayush committed to organize 10,000 camps for elderly citizens within the time frame of 100 days. Beating the target, 14,692 Ayush camps were organized around the country in a massive outreach effort to meet the healthcare needs of the elderly. And in this camp, actually, free consultation, therapies, and guidelines on holistic health approaches, as for example, Ayurveda, Yoga, Unani, Siddha, and Homeopathy, were offered at these camps. Number nine, centers of excellence in Ayush. In partnership with esteemed establishment like Indian Institute of Science, that is Indian Institute of Science Bangalore, Indian Institute of Technology Delhi, and Tata Medical Center Mumbai, and Jawaharlal Nehru University New Delhi. 6 new centers of excellence were founded. These centers, which have been granted rupees 52.47 crore in funding, concentrate on cutting-edge traditional medicine research, teaching, and healthcare innovation. Number 10 achievement is inclusion of Ayush packages in ABPMJY. The ministry convened a review meeting to incorporate Ayurvedic packages under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana to incorporate Ayush treatment into mainstream healthcare, to finalize cost structure and guarantee the affordability of Ayush treatments under the program. A strategic purchasing committee has been established. Number 11, Phase 2 of All India Institute of Ayurveda. All India Institute of Ayurveda Phase 2 to be an advanced center for Ayurvedic research and treatment. A 194-bed hospital and Ayurvedic sport medicine complex and Panchakarma treatment rooms are included in this phase at a total cost of rupees 289.05 crore. The project will greatly improve Ayurvedic research and trading capability. Number 12 achievement, National Institute of Ayurveda, Panchkula, Haryana. The National Institute of Ayurveda coming up in Panchkula, that is in Haryana, with a rupees 294.91 crore investment. This institute will function as a top-tier teaching and research facility with a 250-bed hospital and undergraduate, graduate and postgraduate programs in Ayurveda. Number 13, very important, 3 central research institutes of yoga and naturopathy. The preliminary process for establishing 3 central research institutes for yoga and naturopathy in Odisha, Chhattisgarh and Andhra Pradesh has been completed. Swachhata campaign, the Swachhata Hi Seva 2024 campaign, which focused on cleanliness drives and citizen participation and was co-organized by SBM Gramin, that is Swachh Bharat Mission Gramin, and SBM R1, that is Swachh Bharat Mission R1. We saw actually active participation from the ministry. Swachhata Main Jan Bhagidari, encouraging communal and individual cleanliness via pledge, contests and planting campaigns. Mega Cleanliness Drive, these campaigns focus on making public areas like roads, railway station, water bodies cleanliness, etc. Safai Mitro Suraksha Shibir. It is very important. Health and welfare camps and provide preventive health care and connect sanitation workers with government welfare programs. These are the achievements of our Minister of Ayush in last 100 days. Regional Ayurveda Research Institute, Sri Vijayapuram, promoting Ayurveda research and tribal healthcare. The Regional Ayurveda Research Institute, Vijayapuram, Sri Vijayapuram, a peripheral unit under the Central Council for Research in Ayurvedic Sciences, Ministry of Ayush, Government of India, is actively engaged in advancing Ayurveda research with a special focus on tribal healthcare research. Clinical services and research outreach are RARI operate a regular OPD on all working days, providing Ayurvedic treatment and medicines free of cost to the general public and geriatric patients. The institute also extends its services to the tribal population through its outreach initiatives and tribal healthcare research program. This is very important research program in our institute, and it is a program under Minister of Ayush. And now major achievements of our institute, that means Regional Ayurveda Research Institute, Sri Vijayapuram. Since its inception, RARI has made significant achievements in Ayurveda research and community services. Those are: number 1, upgrade to Regional Ayurveda Research Institute. In October 2016, the unit transitioned from the Ayurveda Tribal Healthcare Research Project to the Regional Research Center of Ayurveda. Thereafter, our institute, the unit was upgraded into Regional Ayurveda Research Institute, Sri Vijayapuram, on 22nd December 2020. Have you understood? Number 2, achievement of our institute, patient care. A remarkable total of 2,16,898 patients have been benefited from free Ayurvedic treatments since inception in 1984. Number 3, achievement of our institute, comprehensive survey. Our institute has conducted extensive health surveys covering 1,37,766 individuals through various Ayurveda tribal healthcare survey projects and an individual 52,138 under the tribal healthcare research program over the years. Number 4, achievements of our institute is research initiatives. That is, the institute initiated a research project titled Medico-Botanical Survey of Andaman and Nicobar Islands in 2012 to explore the medicinal plant native to the region. In November 2016, RARI, that means our institute, organized a national seminar on ethnobotanical practices in Andaman and Nicobar Islands. The release of 2 important publications by the Honorable Minister of Ayush. Recently, under the Tribal Healthcare Research Program, an IMR project is going on. The project's name is or title is Assessment of Acceptability of the Comprehensive Ayurveda-based Healthcare Approach in the Tribal Community and the Effectiveness of Individualized Ayurveda-based Healthcare Approach. It is a cluster randomized trial or study. It is going on, continuing in our institute. It is also the projects under Ministry of Ayush. Our institute comes under Ministry of Ayush. And additionally, an IMR, another project is very important. Its title is a cross-sectional study to assess the prevalence of metabolic syndrome and its association with Prakriti and non-communicable disease risk factors in the adult population of South Andaman district. This project is also going on or continuing in our institute. Number 5, one collaborative project. Research project is very important in our institute. In 2023, our institute signed a memorandum of understanding, that is MOU, with ICAR, that is Indian Council of Agricultural Research, and its sub-unit CIARI, that means Central Islands Agricultural Research Institute, Sri Vijayapuram, to standardize agrotechnics and nursery protocol for Centranthum anthelminthicum. Number 6, achievements of our institute, that is extension activities of our institute. The institute conducts routine extension activities under various schemes for the benefit of general and tribal population of the islands. These programs include distribution of prophylactic Ayurvedic medicines, immunity boosting kits, medicinal plants, nutritional kits, awareness lectures in different free Ayurvedic medical camps, and various programs to promote Ayurvedic traditional food items. And now, last not the least, the Regional Ayurveda Research Institute, Sri Vijayapuram, continues to be a vital resource for advancing Ayurvedic practices and promoting healthcare among the tribal communities as well as general population also in the Andaman and Nicobar Islands through its research, clinical services, and outreach programs.